before we start the special senses, first you need to know what's the difference between the sensation and the perception. What is sensation? Sensation is the feeling of anything that has happened. For example, if somebody touches your body, you feel that something has happened, right? So that feeling of something is the sensation. Then after that, next what happens? You try to understand what was that touch, right? Is it a kiss or somebody touched with finger, right? Or is it hot or cold? What kind of touch is that? So that is the perception, understanding what has happened. Okay, so that's the difference between sensation and the perception. Now, sensations could be two types. Sensations could be two types. One is called somatosensations. Okay, and another type is spatial sensations. Okay, so sensations are two types: somatosensations and spatial sensations. Somatosensations include touch, pain, temperature, pressure. So those belong to the somatosensations. Spatial senses could be different types. Vision, that is sight, audition, hearing, olfaction, smell, and gustation, taste. Okay, so these are spatial sensations or spatial senses: vision or sight, audition or hearing, olfaction or smelling, and gustation or tasting. So those are spatial senses. So we'll talk about this. Now, the difference between somatosensations and spatial sensations is, the main difference is, for somatosensations, you have the receptors throughout the body. You feel touch everywhere, right? In your body. So you have the receptors everywhere in the body. Pain, touch, temperature, those receptors are throughout the body, everywhere, right? But for spatial sensations, for vision, where the receptors are located? In the retina of the eye only, right? You see with the eye. For olfaction, the receptors are inside your nose. For audition, receptors are only inside the ear, inner ear. So for spatial sensations, the receptors are very localized inside the spatial organs. For example, eyes, ears, nose, tongue, right? For gustation. So that is the main difference between the somatosensations and spatial sensations, the distribution of receptors. Okay. Now we'll talk about the spatial senses or sensations. First, we'll talk about the olfactory system that processes the smell or olfaction. Then we'll talk about the gustatory system that processes the taste of food. And then we'll talk about the auditory system that processes the sound. First, one thing you must remember that is very important, that all sensory systems have two parts, the peripheral part and the central part. All sensory systems have two parts. Peripheral part contains the receptors. So peripheral part contains the receptors, and central part is located inside the central nervous system, and that part is responsible for the processing of the signal and giving the perception. So central part is for processing and giving the perception. Peripheral part is just to receive the signal, because receptors are there to receive the signal. So peripheral part is for reception, central part is for processing and giving the perception. Example, when you see something, the picture falls on the retina of the eye. So you have the receptors on the retina of the eye, that receptors receive the signal, right? Then send the signal to the central part, to the central nervous system, where the signal is processed and giving you the perception of vision. Now for olfaction, the peripheral organ or part is the nose. You know that nose is the peripheral organ, and inside the nose you have the epithelium, the lining, and that epithelium contains the receptors. Okay, here you see inside the nose, and when you smell something, the smell molecules, although we don't see, but the molecules are very small and can float in the air. They are so small that we don't see, right? But they can float in the air. For example, you are smelling a cake in front of you. From the cake, the smell molecules or odorants will fly and will enter into your nose and will bind with the receptors there in the olfactory epithelium. And when that receptor molecule, that is the signal molecule, the smell molecule, binding will occur, then receptor will send signal towards the central part, towards the central nervous system. So you see the smell molecules are entering into the nose and will bind with the receptors there in the olfactory epithelium, and when the binding will occur, the signal will be sent to the central part. First, you see the olfactory nerve fibers, those yellow fibers, take the signal to the olfactory bulb. You have seen the olfactory bulb when you did the dissection of the brain. And from the olfactory bulb, the signal will go to the brain structures through the olfactory tract. So you see the olfactory tract is a bundle of fibers, and that take the signal to the other brain structures. They did not show the other brain structures here, just know that the olfactory tract will take the signal to the brain structures. So this is how the smell signal travels. So here, if you just see the olfactory epithelium, microscopic structure of the olfactory epithelium, you see the left bottom olfactory epithelium. Three types of cells are present in the olfactory epithelium. Receptor cells, those are the main cells, and then you have also basal cells and supporting cells. So those are three types of cells in the olfactory epithelium. The receptor cells are like neurons, neuron-like cells. That means it has a cell body or soma, dendrite and axon, right? So you see the yellow cells, those are the receptor cells. They are like neuron-like cells. So if you see the dendrite, the end of the dendrite has cilia. You see all the way bottom, the end of the dendrite has olfactory cilia, hair-like, soft hair-like structures, and olfactory receptors are located there. So you see, olfactory receptor cell and receptors are two different things. This is the cell, the axon. This is the dendrite. Okay, these are the cilia. And this is the receptor cell, neuron-like cell, this whole thing. Okay. Now, on the cilia, you have the receptors. So these are the receptors attached to the cilia. Tiny protein structures. Okay, so these are the receptors. Now, what happens when you smell something? The odorant molecules, smell molecules, enter into the nose and bind with the receptors here on the cilia. So that is the receptor molecule binding. Okay. When that binding will occur, then what will happen? The cell will be depolarized and action potential will be produced. Action potential. You know that the ion channels, sodium channels get opened, ions get in. We have talked about depolarization. When the depolarization will occur, that is the action potential. That means the signal, electrical signal will be produced and will go through this, to the axon. Okay. So first, you see now that through the axon, the signal will move towards the olfactory bulb. You see that top part, that yellow structure is the olfactory bulb. So the axon of the receptor cell will take the signal to the olfactory bulb. Inside the olfactory bulb, you have the neurons, because that's a brain structure. And those neurons are called the mitral cells. So in the olfactory bulb, you have the mitral cells. They will receive the signal from the receptor cells, axons of the receptor cells. Okay, and just know that inside the olfactory bulb, you have the mitral cells. They receive the signal from the receptor cells. And now you see, you already know the synapse, right? Axon ends on the dendrites of the mitral cells. You see where the axon ends on the dendrites of the mitral cell. If this is the mitral cell, these are the dendrites. This is the mitral cell. Okay, in the olfactory bulb. Where the axon ends on the dendrite of the mitral cell, that is called the glomerulus. Okay, glomeruli is plural. So glomeruli are the areas where axon ends on the dendrites of the mitral cells. Axons of the receptor cells end on the dendrites of the mitral cell. That is the glomerulus. Okay, now the axon of mitral cell bundled together, because you have many mitral cells, the axons will bundle together, and that is the tract, olfactory tract. Okay, so olfactory tract is formed by the bundle of, tract is the bundle of fibers or axons. So bundle of the axons of mitral cells form the olfactory tract, and that tract takes the signal towards the brain structures. Okay, so we'll see which brain structures receive the signal from the olfactory bulb. Okay, but before you go to the next slide, just know that three types of cells are in the olfactory epithelium. Main cells are the olfactory receptor cells, neuron-like cells, and the end of the dendrite has the cilia, where the receptors are attached, and the smell molecules will bind with the receptors. That will cause the action potential. That will send the signal. Okay. Now, You see the axons, these axons of olfactory receptor cells are called the olfactory nerve fibers. So basically, olfactory nerve fibers are nothing but the axons of the receptor cells. Okay, and those olfactory nerve fibers pass through the cribriform plate of ethmoid. You must remember, in the ethmoid bone, you have the cribriform plate, and it has many holes, olfactory foramina in the cribriform plate of ethmoid. Now you understand why those holes are there, for the olfactory nerve fibers or axons to pass through, and then from the nose to the olfactory bulb. Because olfactory bulb just lie on the cribriform plate of ethmoid. Okay, so that's why there are many holes in the cribriform plate. Okay, now the main cells in the olfactory epithelium are the receptor cells. Other cells are supporting cells and basal cells. Just know that basal cells are stem cells, so they can multiply and produce new cells in the olfactory epithelium, which is very important because you all know that often we get infection or cold, right? And many cells in the olfactory epithelium die. When you even sneeze, cells die. So quickly new cells should be produced in the olfactory epithelium, and that's why you have the basal cells there, since the cells are dying all the time, to produce new cells to replace the dead cells with new cells. That's the function of the basal cells. Okay. Now, uh, olfactory tract sends signal to which brain structures? Olfactory tract sends signal to four important brain structures: olfactory cortex, hypothalamus, amygdala, and limbic system. Those are four brain structures receive the signal from the olfactory tract. And the olfactory cortex gives you the perception of smell. What kind of a smell is that? Is it a mango or banana or a rose flower? What kind of a smell is that? That is given by the olfactory cortex, that perception. You can discriminate which kind of smell is that. What smell is that? Hypothalamus, amygdala, and limbic system. These three structures are related to the olfactory memory and emotion. What is that? You all know that if you go to the movie theater, what do you smell? Yeah, you smell popcorn, right? So you memorize that is smell, right? And even if you think that I will go to the movie theater again, you may start to smell that in your memory, because olfaction or smell is stored strongly, heavily in your memory system. And these three structures, hypothalamus, amygdala, limbic system, are responsible for olfactory memory. Emotion. You know that small infant, if the infant is crying and if you give the infant to mother's lap or even close to mother's body, infant can smell mother's body and stop crying, right? So you see that emotion is very much related to the smell. Smell is very much related to emotion. When you were a small child, your mom used to cook food for you, and for example, you have left the country for many years, and if you somewhere you eat that kind of food, you quickly get emotional, right? You remember and you get emotional. So your smell is very closely related to the memory and emotion, and those three structures, hypothalamus, amygdala, and limbic system, just know that they are responsible for memory and emotion. but who is giving you the perception, immediate perception, what smell is that? That is the olfactory cortex. Another important information here is the smell signal bypasses the thalamus. It doesn't relate in the thalamus. You know that thalamus is the major sensory relay station, right? That means almost all sensory signals are relayed in the thalamus, but I said almost all. That means there are few that won't go to the thalamus. This is one. Okay, will not be relayed in the thalamus. Uh, Gustatory system. Gustatory system is responsible for the taste. The peripheral organ for the gustatory system is the tongue. Why? Because the receptors are located in the tongue. If you see the surface of the tongue, you'll see many tiny structures. Those are called the papilla. 4 types of papilla are present on the surface of the tongue. 4 different types of papilla. In the entire front part of the tongue, you have filiform and fungiform. Here, they didn't show the filiform. So, in the front of the tongue, throughout the surface, you have filiform and fungiform. Those 2 types of papilla. And in the dorsal part or back part of the tongue, if you go all the way to the back, you'll see some papilla. Those are larger in size and they line up in a way that looks like inverted U or V in the back of the tongue. So these papilla that form inverted U or V shape arrangement, these are circumvallate papilla. Okay, circumvallate papilla. You see, they form like this. Okay, so that is circumvallate. Now, in both sides of the back of the tongue, you have foliate papilla. In both sides of the back part of the tongue, and they look like folds like this, foldings. These are foliate. So circumvallate, foliate, and filiform and fungiform are distributed throughout the front part of the tongue. Okay. Now, among those 4 types of papilla, your taste buds are located only in 3 types, not in all 4. In which 3 types of papilla, you have the taste buds, fungiform, circumvallate, and foliate. Filiform papilla are empty. They don't have the taste buds. They are responsible for the texture of the food, not the taste, but the texture of the food is given by the filiform. Okay, so those are different types of papilla that you can see on the surface of the tongue. Now, if you just take a papilla and open it, inside the papilla you'll see the taste bud, and so this is the bud, taste bud. Inside the papilla you have many taste buds like this, and inside the taste bud you have the taste receptor cells. Remember, we have talked about the receptor cells, olfactory receptor cells. So these are the taste receptors cells inside the bud. And on the apical end, upper end of the receptors cells, you have brush-like structures, hair-like structures like this. Okay, and this is the cell nucleus, okay, like this. So these are the receptor cells inside the bud. So inside each bud you have a number of receptor cells, and the upper end of the taste bud has an opening pore. This is called the taste pore. P-O-R-E, taste pore. Okay, so tiny opening or pore. So that's how the taste receptors are located inside the taste bud. So now if I want to see from the larger to the smaller how the taste receptor cells are located, first is the tongue, right? Tongue, and on the surface of the tongue you have the papilla, and inside the papilla you have the taste buds. These are taste buds, and they are like oranges. You know the oranges? If you peel the skin of an orange, inside the orange you will see what? Segments, right? Slices. So those slices are the receptor cells. Okay, so inside the taste bud, which is like an orange, you will see the slices. Those are the receptor cells. Okay, so that's how the taste receptor cells are located. Now what happens, you see, when you eat something, the food molecules get mixed with saliva, and that liquid will pass through the taste pore and will enter into the bud and will bind with the receptors on the hair, because the receptors are tiny structures attached to the hair. So the food molecules will enter and will bind with the taste receptors, and that will produce the action potential, and through the nerves axons the signal will go towards the central nervous system. Okay, so the basic idea is same in all sensory systems. The receptors will be activated, action potential will be formed when the signal molecule will bind with the receptors. Then the activation will occur and electrical signal or impulse will go towards the central nervous system. Okay. Here you see inside the taste bud, those slices or segments are the receptor cells, and you see the hair in the upper end of the receptor cells, and you also see the pore here, taste pore. This is the taste pore. So food molecules will enter and will bind with the receptors on the hair. When that will happen, depolarization and action potential will be produced. Signal will start to move towards the central nervous system through the nerve fibers. Hair is more like hard, brush like, surface, and cilia are soft. Both are hair like, but soft hair and hard hair. Okay. Now, which nerves take the signal from the taste bud to the central nervous system? You need to know. Okay. The nerves are cranial nerve number 7 and 9. That means cranial nerve number 7 is the facial nerve. You write it down. Cranial nerve number 7 is the facial nerve. And cranial nerve number 9 is the glossopharyngeal. So those are the two nerves. Facial is number 7, and glosso means what? Yeah, pharyngeal, number 9. Okay, those two cranial nerves take the signal from the tongue to the central nervous system. First, the taste signal will be taken to a structure in the medulla oblongata. In the medulla, that structure is called the solitary nucleus. Okay, solitary nucleus in the medulla oblongata. So first, the signal will be relayed there, the taste signal. Then from the solitary nucleus, the signal will go to the thalamus, the major sensory relay station, and will be relayed there in the thalamus. And then from the thalamus, the signal will go to the gustatory cortex and also to the hypothalamus and limbic system. You already know that hypothalamus and limbic system are related to the memory and emotion. Taste, memory, and taste related emotion. And gustatory cortex will give you the perception, immediate perception of the taste. By tasting the food, you can tell if it is a cheese or a butter or sweet or sour, right? You can tell that. So that perception is given by the cortex, gustatory cortex. What taste is that? And memory and emotion are given by the other structures, hypothalamus, limbic system. Appreciation of taste is also given by those structures. What is that? After you eat, you can eat two cakes, two different cakes, right? And you can tell this one is better than this one. Or you can eat two mangoes and can tell that this mango tastes better than this, right? So that is the comparison, which one is better, and that's the appreciation. So that is also given by the hypothalamus and limbic system. But immediately after you eat, you can tell what? If it is a mango or a banana, you can tell that, right? Then if I give you two mangoes, then you can compare that which one is better. This one is good, this one is bad. Same thing if two persons cook. You can eat and tell, yeah, he is a better cook than this, right? So that is a different thing, is given by the other brain structures. But eating both, you can tell this is what kind of food is that, right? So here you see the pathway from the tongue. The signal is taken to the medulla oblongata, where you have the solitary nucleus in medulla oblongata. And then from there, the signal will go to the thalamus, and from there to the brain structures, cortex and hypothalamus and the amygdala. Okay, so that's the gustatory system. Yes. Yeah, vagus nerve is autonomic. What is that? That is not related directly to the taste. You have the taste buds in the tongue, but also that I didn't mention that taste buds or taste receptors are present in a small number in the pharynx, okay, also in the all the way down to the vocal cord. So that is not on the tongue, but from those receptors the signal is taken to the brain by the vagus nerve, okay, outside of the tongue, yeah, from outside of the tongue. Epiglottis, you see, has the taste receptors. Pharynx has the taste receptors. Okay. Now, a couple of clinical conditions related to the taste or smell. Anosmia is a condition where the patient does not smell anything, although other people smell, but the person doesn't smell. Lack of or absence of smell perception is anosmia. A means, remember, absence. No smell, perception. Phantosmia. Phantom. Ghost. You know, phantom means ghost, right? Phantom. Have you heard this word before? Phantom? No? Yes or no? Okay. So, phantom means what? Okay, ghost. Okay. Uh, not real. Make sense? Not real. So, phantosmia. Although there is no source of smell around you, the person smells strongly, sometimes very strongly, although there is nothing around the person. Okay, so that is phantosmia. Uh, Ageusia. A means again absence, but remember geusia indicates gustation, taste. So ageusia is absence of taste, no taste. The person will not taste any food. Dysgeusia, disorder of taste perception. That means the person is eating something, but he's tasting different. Okay, like you are eating banana, but you are tasting orange. So that's the dysgeusia, distorted taste or disorder of taste. Uh, Phantogeusia, same way as phantosmia and phantogeusia. The person is eating something, although there is no food in the mouth, the person will taste the food without the presence of any food molecule in the tongue, on the tongue or in the mouth. The person will taste the food. Okay, so that is phantogeusia. No real food, but the person will taste. So those are some disorders related to the smell or the taste. Okay. Now we'll talk about the auditory system. Auditory system is responsible for the processing of the sound, hearing. Like the other sensory systems, auditory system also has a peripheral part and a central part, right? What's the peripheral organ for hearing? Ear. So the peripheral organs are ears, and central part is in the central nervous system. If you see the structure of an ear, it has three parts: outer ear or external ear, middle ear, and inner or internal ear. So ear has three parts. Outer ear consists of the pinna, external acoustic meatus, that canal, and the tympanic membrane. So those are the structures of the outer ear. Then the middle ear is a cavity inside the temporal bone. You know that this bone is the temporal bone, right? Here you have the temporal bone. Inside the temporal bone, you have a cavity, that is the middle ear. And inside the cavity or middle ear, you have three tiny ossicles, three small pieces of bones, very small bones. Those are called ossicles. And two muscles. So in the middle ear cavity, you have three ossicles and two muscles. Okay. We'll see what are those ossicles or tiny bones and muscles. Then OSC. Then the inner ear or internal ear, which is the most important part. Why? Because the receptors are located in the inner ear. Always remember, in the peripheral organ, the most important structure is the structure where the receptors are located, because they will receive the signal, right? For example, in your nose, inside the nose, you have several structures, right? Which structure is the most important for smell? The olfactory epithelium, because the receptors are there. You remember I said that the receptors are in the olfactory epithelium. So if the olfactory epithelium is destroyed, then what will happen? The receptors are destroyed, right? So that means what? You will not smell, right? Because receptors must bind with the molecules, right? Otherwise, signal will not go to the brain. So inside your eye, where the receptors are located, in the retina of the eye. That's why that's the most important structure. If that is disturbed, you will have problem. Okay, so inner ear has three structures: cochlea, tubules, and also another structure that is not written here, vestibule. So in the inner ear, you have three structures: cochlea, then the vestibule, and tubules. Okay. These are the three structures in the inner ear. Cochlea contains the receptor cells. Sound receptor cells. Okay. So sound receptor cells are located inside the cochlea. So if the cochlea is destroyed, what will happen? You won't hear, right? So that's why you know that cochlear implant, right? Recently we know that you can make artificial cochlea and implant that. So inside the cochlea you have the sound receptor cells, and this structure is responsible for sound. Vestibule has nothing to do with sound. Vestibule and the tubules, these two structures are responsible for balance, equilibrium. So balance and equilibrium are maintained by the vestibule and tubules. So although they are located inside the ear, they are not related to sound. They are related to the maintaining the balance. And you know that sometimes if any lesion occurs inside the ear, you may feel vertigo, imbalance of the body. That also happens, right? So two things can happen. If the cochlea is disturbed, you will not hear the sound. If any of these structures are disturbed, then you may lose the equilibrium of the body. Okay, so those are three parts of the ear. Here you see those three parts of the ear. First, the outer ear. Pinna is the structure that you see from outside. Okay, and then the acoustic meatus. External acoustic meatus is the canal that takes the sound waves to the tympanic membrane. And tympanic membrane is a round, flat membrane, and that is also called the ear drum. Tympanic membrane is also known as the ear drum. So sound waves enter into the ear and hits the tympanic membrane. So tympanic membrane starts to vibrate, shake like this. Okay, you know that sound is nothing but waves in the air like this. So many waves go one after another and enter into the air, and this is the tympanic membrane. Will hit the tympanic membrane one after another, so the tympanic membrane will shake like this. Okay, because it is a thin, flat, round drum. Okay, then you see the middle ear. It's a cavity in the temporal bone. It has three tiny ossicles: malleus, incus, and stapes. So those are three ossicles. They did not level here, but you see three tiny bones. And then you see the inner ear. Cochlea is that snail-like structure. That is the cochlea. And also you have tubules, you see the upper part, and vestibule is in the middle. So this is the cochlea. This area is called the vestibule, and these are the tubules. Okay. So that is the structure of the ear. Okay. Now here you see the name of the ossicles, tiny bones in the middle ear. First one, which is attached to the eardrum or tympanic membrane, that is the malleus. So this is the tympanic membrane, and the first ossicle is the malleus attached to the tympanic membrane, and the other end of malleus is attached to the incus, the second ossicle. So this is the incus, and then the end of the incus attached to the steps, and the steps end on the oval window. This is the oval window. Okay. It's a membrane, thin membrane, oval shaped membrane. That's why this is called the oval window. So malleus, incus is the middle one, and last one is the stapes, and the stapes ends on the oval window. Okay. And then the cochlea is here. You know that cochlea is a coiled snail-like structure like this. Okay, so this is the starting of the cochlea, oval window. So when the tympanic membrane starts to shake like this, all these three ossicles will do what? Because the first one is attached to the tympanic membrane, so all those three ossicles will shake like this. Make sense? Because they are attached to each other, and that will amplify the pressure of the sound. So sound pressure is amplified by the movement of the ossicles. That's why you have three ossicles. When they will shake, they will amplify the pressure, increase the pressure. And this is the last one. The stapes will shake also, and that will push the oval window back and forth like this, because stapes is attached to the oval window. So oval window will also move like this. Now you see what is interesting. Inside the cochlea, you have fluid. Cochlea is a snail-like fluid-filled structure. So filled with fluid. So when the oval window will shake like this, wave will be created in the fluid, in the cochlea. Okay. So that's why you need the amplification of the pressure, because you just think that to move the air or to move the fluid, in which one you need more pressure? To move the air or move the fluid? Which one needs more, where you will feel more resistance? If just put your hand in air and move like this, and put your hand in fluid and move like this, where you will feel more resistance? Fluid. So which one needs more pressure to move? Fluid. That's not a difficult question. Okay, so here the pressure is in the air, right? The sound pressure is in the air and going to hit the tympanic membrane. Tympanic membrane is shaking, but this pressure is not strong enough to move the fluid. Make sense? This pressure is not strong enough to move the fluid. So what you have to do? Amplify, right? And that is done by the ossicles. Otherwise, wave will not be created in the cochlear fluid. Okay. So here again you see the middle ear cavity, 3 ossicles, and I told you that there are 2 tiny muscles are also in the middle ear. What are those 2 tiny muscles? One is called the tensor tympani muscle and another is the stapedius. So stapedius and tensor tympani are the muscles. Muscles support the ossicles. Those 2 muscles support the ossicles to stay in right place. Now the inner ear or internal ear. 3 structures I have already mentioned. Now cochlea contains the receptors, sound receptor cells, and cochlea is a snail shaped coiled fluid filled structure. I am repeating again. Cochlea, what's the shape? Snail shape. Coiled fluid filled structure. Filled with what? Fluid. So, it's like this. Okay. If you take a tube and coil it, that's the cochlea filled with fluid. Now, here you have the oval window steps. Okay. Now, since it is a coiled structure, I can make it straight. I can hold here and pull it and make it straight. So if I make this tube straight, it is like this. Okay. And now, if I see inside, what I'll see 2 membranes like this. So inside the cochlea, you have how many membranes? 2 membranes separating inside the cochlea. Into how many chambers? If you put 2 membranes inside this room, how many chambers you will get? 3. Make sense? So inside the cochlea, you have 2 membranes. That means 3 chambers or cavities. Upper one is the vestibular membrane. And lower one is the basilar membrane. Okay, vestibular membrane and basilar membrane. And those 2 membranes separate into 3 cavities. Remember, all those 3 cavities or chambers are filled with fluid. Okay. Now, if I make a cross section, like take a piece from here, this part, and see here, how many membranes? 2. This one is what? Upper one. Vestibular membrane, right? This one is basilar membrane. Is it clear? 3 cavities filled with what? Fluid. Okay. That's the cochlea, inside the cochlea. The upper chamber is called the scala vestibuli. Scala vestibuli. And middle one is called the scala media. And the lower one is scala tympani. Okay. So those are 3 cavities. Scala vestibuli, scala media, and the scala tympani. Now, this is very important. on the basilar membrane, you have a structure, very important structure, that is called the organ of Corti. Some places you will see cortical organ, same thing, organ of Corti lies on the basilar membrane. Why this structure, organ of Corti, also called the spiral organ of Corti or cortical organ? Why this is the very important structure? This is a very important structure because the hair cells, the sound receptor cells, are located inside it. So these are the sound receptor cells, nucleus. These are also called hair cells. And the upper end you have hair. Okay. Two types of hair cells or sound receptor cells are present in the organ of Corti. Outer hair cells and inner hair cells. Just know that there are two types of hair cells, and hair cells are the sound receptor cells. They have hair. The outer and inner hair cells in the organ of Corti. And on the top of the hair cells you have what? Hair. Right? On the top you have hair. Now, that's why organ of Corti is the most important structure, right? Because it contains the sound receptor cells. And sound receptor cells are the hair cells. Is it clear? Okay. Now, on the top of the organ of Corti, you have a soft jelly-like membranous structure, or you can say soft jelly-like membrane, that is called the tectorial membrane. Tectorial membrane. On the top of the organ of Corti, you have a soft jelly-like membrane just lying on like this, and that is called the tectorial membrane. And since it is a soft jelly-like membrane, the hair of hair cells hairs pass through it, enter into it like this. Okay? So all these hair go or inserted into the tectorial membrane. So this is the tectorial membrane, soft, okay, like what? Jelly. And this is the hair cell, okay? These are what? Hair, right? This is the tectorial membrane. It will go like this. Make sense? It will be inserted into the tectorial membrane. Is it clear? Okay, good. Now, you remember I told you when three ossicles will shake like this, the last one is the stapes, right? And that will push the oval window. So oval window will move and waves will be created in the fluid. You understand that, right? So waves will be created. Now the fluid is everywhere inside the cochlea. So when here you have the oval window, so oval window will move like this, waves will be created. Okay, so the wave will do what? Will push the basilar membrane up and down like this. Because this is fluid, wave in the fluid will push the basilar membrane up and down. Make sense? Okay, so now you see this is the tectorial membrane here inserted, and here you have the basilar membrane, right? In the bottom of the hair cells. So basilar membrane will move up and down like this. So every time you see the basilar membrane will push the hair cells up and down like this, the hair will get bent and straight, Make sense? Because you are pushing from the bottom up and down. So every time the hair will bend, ion channels will get open and sodium ion will get in, and that will cause the depolarization and action potential. Okay, so the action potential will be formed and the signal will go to the central nervous system. So you see, if I ask you how the hair cells or sound receptor cells are activated by the bending of the hair, right? And that will open the ion channel. It's like you are closing and opening and closing the door. So when the hair bends, ions get in, and that causes the depolarization, action potential, and electrical signal will be sent to the central nervous system. So that's the mechanism. Okay. Here you see the slice of the cochlea. So you see three cavities, two membranes, the vestibular membrane, basilar membrane. Now you see on the basilar membrane the spiral organ of Corti, and inside it you have the hair cells. This is the organ of Corti. You see two types of hair cells, the inner hair cells and the outer hair cells. And on the hair cells, you have the hair, and those hair are inserted into the tectorial membrane. You see the tectorial membrane, which is soft jelly-like membrane. Okay? Under the microscope, you can identify the outer and inner hair cells, because outer hair cells form inverted V or U-shaped arrangement, but inner hair cells are linear, like line, long line. Okay, now from the hair cells, the nerve that takes the signal to the central nervous system is the auditory nerve. Make sense? It's the auditory nerve, also called vestibulocochlear nerve. Same thing, auditory or vestibulocochlear nerve. Cranial nerve number 8. Cranial nerve number 8 is the auditory or vestibulocochlear. That nerve takes the signal from the hair cells to the central nervous system. Just I'll mention the name of the structures where the signal will be relayed. First, the signal will be taken to the cochlear nuclei in the medulla, and from there we'll go to superior olivary nuclei in the medulla. So in the medulla you have two nuclei, cochlear and superior olivary. And from superior olivary, the signal will go to the inferior colliculus. How many of you remember inferior colliculus? Show me hands. Show me your hand. Superior inferior colliculi. How many of you remember? Have you heard that name before? Show me your hand. How many of you have heard it? Nobody? Superior colliculi, inferior colliculi. Nobody. Have you heard corpora quadrigemina? Yes. Yes? How many of you have heard? Show me hands. Corpora quadrigemina. I said you have heard the name. I didn't ask you where it is located. Have you heard the name of Corpora quadrigemina? Show me hands. 1, 2, 3, 4. This side? Never. Have you done the brain, dissection of the brain? Brain dissection? Sheep brain dissection? Are you sure? I don't believe that. I can't believe that. I showed you, all of you. I showed to all of you. Corpora quadrigemina. Quadri means what? Have you heard 4 round structures? This side? Don't remember? 2 two round structures are bigger, upper two, lower two are smaller? You don't study.
I'm never down.
You guys don't study. Okay. So which two are bigger? Upper two or lower two? Upper two are bigger. Superior colliculi, right? And lower two are inferior colliculi. Okay. So superior colliculi processes the visual signal. Inferior colliculi process the auditory. So the signal will go to inferior colliculi. I showed you, you remember the brain, sheep brain, if you just cerebrum and cerebellum, if you move like this from the back of the midbrain, you'll see four round structures. Quadri means four. Okay. So the signal will go to inferior colliculi. And then from there to the thalamus, because thalamus is the major sensory relay station, right? And then to the auditory cortex. Where the auditory cortex is located? In which lobe? Temporal lobe, upper part of the temporal, right? Near the lateral sulcus. So we'll go to the temporal lobe where you have the auditory cortex. So that's the pathway of auditory signal. Hair cells, cochlear nerve, vestibulocochlear nerve or auditory nerve, cranial nerve number what? 8. Will take the signal to the cochlear nucleus and then from there superior olivary nucleus to the inferior colliculi, then to the thalamus and the auditory cortex in the temporal lobe. Okay. Hearing loss. Two types of hearing loss we know. There are two types. One is the conductive hearing loss and another is sensory neural hearing loss. Conductive hearing loss occurs due to a blockage in the of the sound wave. So if any blockage occurs inside the ear, that will stop the sound waves from entering into the ear. That is the conductive hearing loss. Sound will not be able to enter into the inner ear. For example, if you put a cotton ball, cotton ball in your ear, sound waves will not enter, right? So that is what? Conductive hearing loss. Is it clear? If any tumor is formed inside the ear, that will stop the sound waves from entering into the inner ear. That is conductive hearing loss. Sometimes fluid, right? Water or fluid can accumulate in the ear. That will not let the sound waves to enter into the ear. So that is conductive hearing loss. Is it clear? Okay. So is it difficult or easy to fix that problem? Easy, right? If wax is formed, you can clean it, wash it, right? And that will take care. If tumor is there, you can remove it. If infection is there, fluid is there, you can take it out, right? So relatively easy. You can fix that. That is the conductive hearing loss. But sensory neural hearing loss occurs due to the destruction or loss of the hair cells. So if the hair cells die, that is the sensory neural hearing loss. And remember, there is no basal cells or stem cells in the organ of Corti. Do you remember the basal cells in the olfactory epithelium, right? I said the cells are dying all the time, so new cells are being produced. In the tongue, you have also the stem cells, basal cells. But there is no basal cells in the organ of Corti. So once the hair cells are destroyed here, no new hair cell will be produced. Make sense? And that's why the sensory neural hearing loss is not easy to fix because the hair cells will not regenerate. In that case, what you can do, you can put the artificial cochlea, right? that can work partially, but not as your organ of cortex or cochlea. What can cause sensory neural hearing loss? Couple of common causes. One is prolonged exposure to the high frequency noise. Prolonged exposure to high frequency noise. Example, those people who work in a factory, right? All the time high frequency noise is being produced there. You have to use the mask to cover the ear. Otherwise, you might have sensory neural hearing loss. Another is the chemicals, particularly high dose of strong antibiotics. Some antibiotics like penicillin can cause the death of the hair cells. Okay, so if you take the penicillin in very strong high dose, that may cause, usually the infants or small children, when they take strong antibiotics in high dose, that can cause the loss of the hair cells. Tinnitus is a condition that is called ringing in the ear, ringing inside the ear. The person suddenly listens sound, although there is no source of sound around. Other people are not listening anything, but the patient or person of tinnitus will listen. Suddenly will listen the sound. That the frequency of tinnitus, if it is frequency is low, that means the frequency of occurrence is low. That means the person listens sound once in every 2 months or 3 months. That's fine, right? That's not a big problem. But if the frequency of occurrence is high, like every night when you are sleeping, you suddenly, listen the sound, that will be very bothersome, right? Will be very disturbing in your life. So we don't know yet the exact reason of tinnitus, what causes the tinnitus. But what we know that if the hair cells start to produce action potential, you remember I said that when action potential is produced, the signal will go to the brain, right? The signal will go to the brain. And we also know that when sound waves enter into the ear, the bending of the hair will open the ion channel, action potential is produced, right? That activates the hair cells, right? We know that, bending of the hair. But if without any sound waves entering into the ear, bending of the hair occurs inside the ear, that will produce the action potential, right? That is called intrinsic activation of the hair cells without any outside chance. If the hair cells suddenly start to produce action potential, your brain, the interesting thing here is that your brain doesn't know. It is sitting inside the dark cavity, right? Cranial cavity. It doesn't know from where the electrical signal is coming. It just knows how many times the signal is coming. That is very interesting. If I can put an electrode from outside on the hair cells and send electrical signal to activate the hair cells. Hair cells will get activated, right? And we will start to send signal to the brain, to the auditory cortex, and we will listen the sound. This is very interesting, isn't it? So you can produce that perception without actual thing happening. If I stimulate the taste receptor cells in the taste bud using electrode, put electrode and send electrical signal there, and action potential will be produced there, right? We'll send signal to the brain, you will taste. So it's all digital. Brain doesn't know is it coming from outside or inside. It only can count how many times. If, for example, if it is 5,000 times from the tongue, it will give you the perception of sweet. If it is 10,000 times it is sour. If it is 15,000 times, it is bitter. So brain can just count and gives you the perception. So that is very interesting. So anything that can activate the hair cells can cause listening that sound. Okay, so that is the tinnitus.